What does full informed consent look like when starting an SSRI? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I'm doing a series where I go through each of the different psychotropic medications that we commonly prescribe and actually going through the informed consent process that I would go through with a patient of my own to show you how informed consent can or should look. And I'm not going to be perfect with this. There may be things that I miss, and feel free to put those in the comments so that I know how to do better. So I'm starting off this series with SSRIs, which are probably our most commonly prescribed medications in psychiatry. These include medications like sertraline, otherwise known as Zoloft, fluoxetine, otherwise known as Prozac, citalopram, otherwise known as Celexa, escitalopram, otherwise known as Lexapro, paroxetine, otherwise known as Paxil, and fluvoxamine, otherwise known as Luvox. So generally, these are, like I said, one of the most commonly prescribed medications in psychiatry, and we say that it's because they're well tolerated and effective. However, that is definitely not true for a lot of people. These medications can be used to treat a number of different conditions, including anxiety, PTSD, major depressive disorder, eating disorders, panic disorder, OCD, and others. Common side effects include things like headache, dizziness, upset stomach. We generally recommend that you take them with food. There's also a small increased risk of bleeding. So if you notice things like bleeding when you're flossing, increased bruising, or having a heavier period or blood in your stool, these could be potentially attributed to the effect of the medication. Usually I worry about this mainly with patients who have a known bleeding or clotting issue or they're on a blood thinner. There also can be sexual side effects like decreased libido, difficulty achieving orgasm, difficulty sustaining an erection. Now, most of the time when the medication is discontinued, the sexual side effects will go away. However, in some cases, the sexual side effects can persist for months or years. This isn't very common, but obviously it can be significant for those for whom they are affected by it. In adolescence, which we say is up through age 25, because that's when your frontal lobe is done developing, we say that there is an increased risk of suicidal thoughts. There's a black box warning for this. So if you're noticing increased negative thoughts or suicidal thoughts or thoughts of self-harm, then definitely let us know right away. And that's something that we should discuss. For some patients, these medications make them feel more tired, while for others, they make them feel more awake. So you can take them either in the morning or in the evening, whichever is best for you. For some individuals, it can trigger something called mania, which is typically thought of as a component of bipolar disorder, but symptoms or signs that would be concerning for this would be insomnia, increased agitation, mood lability, rapid speech, increased activity, and in rare cases, there can be psychotic symptoms like auditory hallucinations or paranoia or other delusions. Now, this list isn't exhaustive of all of the potential side effects, but these are probably the most common ones. But if you do notice a symptom that is new since you've started the medication, let's talk about it because there's a chance it could be related to the medication. The other thing to keep in mind is that in general, the longer that you're taking this type of medication, the more challenging it can be to get off of them. And so there can be risks of things like protracted withdrawal if a slow, methodical taper isn't considered if you've been on the medication for quite some time. So it's important that we talk about your goals as far as how long you want to be on the medication, what your priorities are as far as the approach towards your care, and any other questions you might have. Now, some of the SSRIs, I might have some additional side effects to note. So for example, sertraline or Zoloft is the one that is most commonly associated with GI upset. Fluoxetine or Prozac tends to be a little more activating, so I recommend taking that in the morning. And Paxil or paroxetine has the most anticholinergic side effects, so you're more likely to experience symptoms like sedation, drowsiness, dry mouth, dry eye, weight gain. I didn't mention that changes in weight, either weight gain or weight loss associated with changes in appetite, is also a fairly common side effect of these medications. So back to Paxil, additionally, there's increased chances of sexual side effects and urinary issues. So then I would say, given all that information and your specific situation, what are your thoughts about starting a medication? Is that something you're interested in? So that's basically how I go through the informed consent process with an SSRI. If there's another medication that you'd like to hear how I do informed consent for, please put in the comments below. Wishing you all good mental health, and I'll see you in the next one.